Keir Starmer sort of made history today. It's the first sort of Labour Prime Minister to stand up and say that the NHS is in a critical condition. It's not about money, it's about reform. We're delighted to be joined. Our next guest, Louise Irvine, is the spokesperson for Keep Our NHS Public. She's a South London GP and a representative for National Health. Louise, a very good afternoon. Welcome to Talk Drive. How are you?
Good afternoon.
What did you make of Sir Keir Starmer this morning, then? What did you make of his words? Because predominantly Labour Party officials and Labour ministers have said the same thing for years, which is just give the poor old NHS more money.
Well, I was really surprised because Wes Streeting, who's the Secretary of State for Health, had commissioned Lord Darzi to do a review of the NHS and the state it was in and make what he called a diagnosis of the problems. And Lord Darzi is a very well-respected senior clinician who is independent of all the parties. He said that the NHS was in critical condition, but was still salvageable if the right things were done to help it. He said the critical condition was because of 14 years of austerity, underfunding, and poor decisions by previous governments. For example, the top-down reorganisation from the Lansley Act in 2010 and the COVID lack of preparation for a pandemic.
Lack of preparation for the pandemic. Can I just jump in very quickly? So are you a person who believes that the answer to the NHS's problems is greater funding?
If the diagnosis of Lord Darzi is...
No, I'm asking you. Do you believe the NHS would be improved by more money?
Diagnosis of undernourishment. The treatment is nourishment.
But surely as well. But Louise, this is the problem that I have repeatedly, and people never answer this.
May have that problem repeatedly, but all of the people who look into issues of NHS funding, who are quite senior, respected think tank.
I'm sure they are, but you let me ask the question. But Louise, let me ask the question: is it just? Why is it always about money? That's all you people ever talk about.
All of those organisations, because the NHS has less funding than comparable high-income countries like France and Germany. It has had a reduction in real terms in its funding over the last 2 years, and its overall funding over the last 14 years has been average 1% per annum increase, which is less than the...
Can I get a word in edgeways? Can I get a word in edgeways?
Growing demand...
Can I get a word in edgeways? 165 billion pounds. A Labour Prime Minister who says, and actually I thought it was interesting, Louise, he said it is not fit for purpose. Now, somebody rang this show earlier, and I just want to put this to you if I can. The NHS, and I started the show by saying this, I believe was one of the greatest inventions in the modern world, along with the benefit system. Are you all right? Have you lost something?
Yeah, I'm just looking for something about the funding. I'd written something down.
I'd just love an answer to this question. There's always this money or no money, OK? Personally, I think the real issue is I don't think it's fit for purpose because I don't think the model fits an older population, a larger population, and there is definitive proof, Louise, whether you like it or not, and I get what you're saying, and I genuinely do, that there is huge... I mean, you're smiling at me like all people in the medical profession do. There is huge wastage of money in the NHS, and you could spend your money in a far better way. And surely what he's saying today is it's not just the coin, it's getting the NHS to serve the right people, to provide the right service, diversity courses and training this and doing that and people going on this, that and the other. Are we giving value for 165 billion? Because many people, including your now Labour Prime Minister, are saying not. And of course you can look back at the debacle that was the Tories. That's gone. But I think we need to get past the argument that it's always, let's do more money. There's got to be more to it than that, Louise, hasn't there?
The money, the austerity that we face is why the NHS is inefficient. If you've got buildings that are crumbling, you haven't got the proper IT, we haven't got enough scanners, we've got hospitals that have had to close sections of their services because of the backlog maintenance issues. If you don't invest in the things that we health workers need in order to provide our services, then of course we will be less efficient than if you properly invest in it. The fact is, and this is not just my opinion, the fact is the NHS has been underfunded. We don't spend enough on capital, on our buildings, on our equipment, on our scanners.
What do we spend it on then? Because let me give you an example. A friend of mine's wife is an A&E nurse. She told me a story that this is a fact. So you know, you're a GP. She's a nurse on the front line. A patient came in, waited 5 hours and basically had a headache, right? They gave her, out of a packet of 60 paracetamol costing, what, £5? I've no idea, 2, and the other 58 were thrown away for medical, what was it called, for sanitary reasons. Do you not think that's a complete waste of money, Louise?
Possibly. I don't know the actual details of the story. It doesn't sound like a good idea. Do you think this is why the NHS has problems, because of an anecdote that you've just described?
I wouldn't describe some story from a genuine person as an anecdote. I think that would be disrespectful.
Well, what about the genuine evidence that the NHS wasted, or the government wasted, on, the NHS, the provision of personal and protective equipment during COVID, as well as the...
You said that the government wasn't prepared for COVID. Was any government in the world prepared for COVID,
yes,
Louise?
Other countries that are comparable to our country did better, had fewer deaths and did better during COVID.
Do you want to keep the NHS public, yeah?
Yeah, of course I do. And
so why are you a GP? Are you a private contractor as a GP or an NHS employee?
I'm an employee of the practice.
Okay. Is that private or NHS?
Independent contractors are independently contracted to the NHS and provide wholly services for the NHS and make no profits personally beyond being paid for their labour. So as far as I'm concerned, that is part of the NHS.
Wes Streeting said that he was also quite keen to look at... Can I just say this, please?
Well, I don't get much of a word in either, do I?
Well, of course you do. You've spoken repeatedly. We both have. I just wanted to say what Wes Streeting said the other day, which was that he believes that the NHS, and Blair had touched upon this, parts of it need private money, parts of it need to look beyond this structure of just money from government. What's your response to that?
Well, if you look at what Lord Darzi said, he said that other countries that have a greater proportion funded through either payment or through social insurance actually cost more. So they're more expensive and therefore less cost effective. The best system, when we had properly funded NHS between 2000 and 2010, we had greatest patient satisfaction, shortest waiting lists and better outcomes. We actually have an NHS model that works if it's properly funded. That is where the evidence is. I'm sorry, Jeremy, it's there.
No, listen, everybody's entitled. They're brilliant. Grant in Bradford says you're talking rubbish. He says the issue with the NHS is the poor management. It's always the managers that will not miss this and demand more funding. Listen, everybody, that's the point of something like this. It's about having an opinion. Louise, we really appreciate you coming on, and I mean that. Louise Irvine is the spokesperson for Keep Our NHS Public.